Is EMS sculpting a long-term solution or just a short-term type of band-aid fix, sort of? Was this produce permanent results or?
Another good question. Does exercise produce permanent results? Does anything produce permanent results? I'm not being facetious, but in order to maintain where you want to be, you have to keep up with it. If you don't keep up with your diet, you don't keep up with your exercise, you don't keep up with your therapy, then you're not going to maintain your results.
Would you say that EMS sculpting is safe in the long term then? Like, I know that we had been over side effects already,
Right.
but is there any long-term lasting effects that perhaps it could have on you?
According to the data, science, there's nothing that EMS is gonna cause anything permanent. Like I said, we are surrounded by microwaves, radio waves, all the time. To say that electrical wave cause any permanent damage, we've been living with electricity for a long time, since Edison discovered the light bulb. So I don't think there's any permanent side effects with this product.
So why would you recommend this procedure in the first place? Why would you look at someone and say EMS sculpting is for him or her?
Well, usually this modality comes into part of your whole treatment plan when my patient tells me I have no time to exercise. If that's the case, then this has to be part of the treatment plan, because getting back into shape and being healthy involves two things. One is diet, and the second is exercise. You can't do what you need to do without those two things. You're trying to bike with your hands behind your back. You're trying to type with your hands behind your back. You can do it, but it's not gonna give you the best results. You can't get good results with just dieting. You can't get good results with just exercise. To do both.
So I read here that one of your modalities for weight loss treatment is called fat away. Could you elaborate on that? What exactly is fat away?
Fat away. That's one of our modality where we inject this medicine to help give you the shape that you want. It's to fine tune. It's not designed to help you lose 10, 15, 30 pounds. It's to fine tune where you want the fat to be dissolved away to give you the figure that you want.
Do you know the ingredients in fat away injections?
Good question. The ingredients is vitamins, B vitamins, and the other pharmaceutical stuff that's listed on the bottle that I won't list here because there's just too many. And is it safe? It's FDA approved, and so it is safe. Otherwise, we wouldn't bring it on to one of our offer as a modality to help sculpt the body.
Right. And I mean, obviously you're a big proponent of cosmetic surgeries and weight loss treatments in general. So, like EMS sculpting, why would you recommend fat away to someone in particular? What makes you think this person needs this particular treatment?
That's a question that's better asked by the patient. Most of the people who desire this therapy has a model shoot that they're going for, and a certain look that they want on the shoot. Some of them have a prom to go to, or a wedding to go to, and they want just to take away that little bit so that they can fit into their dress. They can, to give them a certain figure that they want, and that's where this modality comes in. It's designed to sculpt the body the way that the patient would like to have for that week, for that month.
Right. So is this a short-term solution, or is this, again, a long-term fix?
It can be a short-term or it can be a long-term, as long as you maintain your diet.
Right.
You can destroy everything by being loose with your diet.
So I think that's also a great segue into some dieting options that your practice offers as well. Could you elaborate on your dieting options?
We don't follow any fad at this clinic. We focus on what's tried and true. The only thing that we focus our treatment is around what's healthy. There's a lot of mysteries created by this market to sell books, to sell different fads. We try to do away with all that and keep it simple. So when patients come here, I try to review what are the healthy things that they should focus on and stay with that. They don't need to count calories. They can do whatever they want, but at the expense of their guilt.
Right.
They will know what's healthy to eat and what's not healthy to eat.
Mm-hmm.
They will know when they fail to meet their goal. They know why they fail. The only one that's accountable for their success is them.
Right. So it sounds like you guys have a somewhat, I would say, laissez-faire, hands-off approach to the diet, where you said it's more of a guideline for the patient.
No, I would not say what we do here is laissez-faire. The best analogy that I can think of for what we try to do here is more like a bonsai tree. It's not laissez-faire. We don't do things without plan. It's meticulous, it's careful, and it involves a lot of energy and time. You will not achieve any success in a laissez-faire environment.
Okay. So that's also a segue into more about this dieting and everything. So is there any leniency then in your dieting program?
Yes.
Say that it's
You
Saturday morning and I want
Yes.
to eat that donut?
Yes. This program is as lenient as you are lenient to yourself. Just as long as you know that you are accountable for your success. We're not accountable for your success. We're here to help you achieve your goal as rapidly as you want to achieve it.
When could a patient expect to see results? Because I know, maybe that's the whole impetus that they showed up here in the first place. They want the fat results, they want their gut gone, but maybe they want to go about it with your dieting plan. When can patients expect to see physical change from all this dieting?
In my past 20 years of honing this plan, we have a range of success. Okay, we have success as little as 1 pound a month, or we have success as much as 30 pounds in a month, and everything has to do with the patient's level of desire, motivation. So, how soon can you see it? You can see it within a week. If that is your question, but it ranges across the spectrum, and it all depends on our motivation.
Okay. How do you guys deal with maybe loose skin that a patient may have from either all this dieting or these procedures? How do you guys deal with the loose skin?
Because of that issue, we usually recommend our patients to get on a diet as young as possible, so that you don't have to go through surgery. And the loose skin issues has everything to do with your origin, your heritage. Usually, European origins have more of an issue with loose skins than people from other areas in the world. But what we deal with loose skins is that we have several modalities here that's designed to help tighten the skin and avoid surgery as much as possible. Now, when we talk about people who are more advanced in age when they start and has more loose skin, those really will need to have surgical intervention to solve that problem. But in short of that, we can use our modality to decrease the amount of loose skins that the surgeon has to operate on. Thank you so much, Jonathan. That was both enlightening to you and to me.
Yeah, thank you
I did
so
not
much.
know that there was so many interest and concern about what we do here.
Yeah.
And I'm glad I can answer your question.
Well, thank you for spending the time here with me today. Again, it was very insightful and very enlightening. Thank you again, Dr. Tonthat.